Zonisamide is a medication that is used in combination with other drugs to help prevent and manage seizures in people with epilepsy. It is a type of anticonvulsant that also acts as a carbonic anhydrase inhibitor. The exact way in which zonisamide works to prevent seizures is not fully understood. It is typically taken once or twice a day, with or without food. The dosage and best time to take it will depend on your individual circumstances, so be sure to follow your doctor's instructions carefully. Before starting zonisamide, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually 1 to 2 times a day. To prevent kidney stones, drink plenty of liquids unless instructed otherwise by your doctor. If you are using the capsule form, swallow the capsules whole. If you are using the liquid form, carefully measure the dose using a special measuring device and shake the bottle well before each dose. The dosage is based on your medical condition and response to treatment. It's important to follow your doctor's dosing instructions exactly. Your doctor will start you on a low dose and slowly increase it. It may take several weeks or months to reach the best dose for you. Use this medication regularly to get the most benefit from it. Take zonisamide at the same time each day to keep a constant level in your body. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of zonisamide include dizziness, drowsiness, trouble sleeping, lack of coordination, lightheadedness, loss of appetite, diarrhea, or double vision. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects, such as mental/mood problems, speech problems, decreased sweating, sudden back/side/abdominal pain, painful urination, or symptoms of metabolic acidosis including bone pain/breakage, rapid breathing, fast/irregular heartbeat, sudden/unexplained tiredness, or severe drowsiness/difficulty staying awake. Additionally, it's crucial to watch for very serious side effects such as easy bruising/bleeding, eye pain/redness, vision changes, signs of kidney problems, signs of liver problems, or symptoms of a serious allergic reaction. If you notice any other effects not listed above, be sure to contact your doctor or pharmacist. Remember, always seek medical advice if you have any concerns about the medication. Before taking zonisamide, it's important to let your doctor or pharmacist know if you have any allergies, as this medication may contain inactive ingredients that can cause allergic reactions. You should also discuss your medical history, especially if you have liver or kidney disease, lung/breathing problems, a special diet, or mental/mood issues. Zonisamide can make you dizzy or drowsy, and using alcohol or marijuana can increase these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you know how this medication affects you. You should also avoid alcoholic beverages and discuss your marijuana use with your doctor. If you have surgery planned, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication may also make you sweat less, which can increase your risk of heat stroke. It's important to avoid activities that may cause overheating, such as hard work or exercise in hot weather, and to drink plenty of fluids and dress lightly when it's hot outside. Older adults and children may be more sensitive to the side effects of zonisamide, so it's important to be cautious and monitor for dizziness, lack of coordination, or other symptoms. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using zonisamide with your doctor. This medication can potentially harm an unborn baby, so reliable forms of birth control should be used while taking this medication and for 1 month after the last dose. If you are breastfeeding, consult your doctor before continuing to breastfeed while taking zonisamide. When taking zonisamide, it's important to be aware of potential drug interactions. These interactions can affect how zonisamide works in your body and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Some products that may interact with zonisamide include carbonic anhydrase inhibitors, such as acetazolamide, and orlistat. Additionally, other medications such as phenobarbital, primidone, rifamycins, St. John's wort, and certain drugs for seizures can affect the removal of zonisamide from your body, which may affect how zonisamide works. Your doctor may need to adjust your dose of zonisamide if you are taking these medications. It's also important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always ask your pharmacist about using these products safely. Remember to consult your doctor before starting, stopping, or changing the dosage of any medicines while taking zonisamide. If you or someone you know has taken too much zonisamide and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, severe dizziness, and loss of consciousness. It's crucial to act quickly in these situations. It is important not to share zonisamide with others. Your doctor may order lab or medical tests, such as kidney function, bicarbonate level, or complete blood count, while you are taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. When taking zonisamide, it's crucial to take each dose at the designated time. If you happen to forget a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to skip the missed one and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. When storing zonisamide, make sure it is kept at room temperature and away from light and moisture. Avoid storing it in the bathroom. If you are using the liquid form, make sure to throw away any unused medication after 30 days of opening the bottle. Keep all medications out of the reach of children and pets. Do not flush zonisamide down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.